Hi everybody, my name is Alex Guinness and I am a policy and research specialist at the World Institute on Disability, and I run the New Earth Disability Program, which is looking at how people with disabilities will experience the changing world we have ahead of us, a world of resource shortages and a world of climate change. And what I'm going to be talking about today is the environmental vulnerabilities of people with disabilities, climate change, and our future. So this is looking at how when climate change progresses, we as people with disabilities will experience it, and especially experience it differently to the able-bodied population. Okay, so here we go. Okay, so here's the overview of what's going to happen. I'm going to talk about my story, which kind of going from my childhood and teenage years all the way up until today. Talk about why climate change, what is climate change, and why it's important. People with disabilities as a vulnerable group within that. Impacts and focus areas, because really climate change isn't just global warming as we used to call it. It is aggregate kind of global temperature changing all of these different pieces of the climate. So heat waves and storms and sea level rise and drought, etc. Talk about each of those focus areas. Then some policy solutions, what we can do to safeguard the health and well-being of people with disabilities, and then moving forward, which is how we can build coalitions, build movements, use kind of a mix of policy and activism and methods to get all of that done. Okay, so moving through my interests, and I'm just going to talk about disability activism and then climate change and show how they come together. So disability activism, this is something I've worked on, that I currently work on, is that people with disabilities need support for health and independence. And there's what I view as three different types of support. Number one is medical, which is having quality healthcare, equipment, supplies, medication, and that is, me personally, I've ended up in and out of the hospital for a while. I had some random medical thing that got me in the hospital for a month this past year. I also have the wheelchair, that I need to have wheelchair parts coming in and out of my medical care provider funded by insurance, etc. It's a very complex system. Life quality resources, which is personal assistance. I have personal attendants that help me in and out of bed. My apartment requires an elevator. I have a roll-in shower. That's something that I absolutely need. Transportation here in the Bay Area, we have good accessible transit. Some people with disabilities, depending on where they live, might have a wheelchair van, and jobs that people can do. And actually, that's something else that we work on over at WID, is employment policy, education, and training. Funding and stability, a lot of these things, social services and healthcare services, need funding. They need stable funding. They need political support. And it's kind of based off of, at the same time, economic stability. So we need funding and stability just in terms of social services, as well as interpersonal support, community and family support. When I was in that hospital for a month, I had a phenomenal friend that was there with me and stayed with me while I was in the hospital, was visiting every day or every other day. And other friends visited sometimes, but not nearly as much as this one person. And it made me realize how important in so many ways these interpersonal connections are, and that even carries over to outside of the hospital, in the home, people coming over and hanging out, and someone helping me take my backpack on and off when I get home, etc., etc. And finally, all of these things take time to develop, but in general, they are vulnerable. That the medical system is vulnerable to disruptions. Same with personal assistance. Somebody quits, a personal attendant quits, that's vulnerable. If somebody moves, it's difficult to find accessible housing. Same thing with social services, or if some sort of social network collapses, a best friend and you have a fight, and then you're relying on that person for always driving you around, it can be very, very tenuous and vulnerable for people with disabilities. So it needs support and it needs careful management in order for people with disabilities to have a good quality of life. Okay, and then, so I was interested in disability activism mainly because I realized that there needs to be focus to keep our lives safe and secure. And then I switched to climate change. This is back in college. I kind of fell away from disability and I switched to climate change. Why? Because climate change threatens all of humanity. um, we are all so vulnerable because we have built our society based off of the current climate, based off of this current sea level. All of these different things is how society has developed. And it's similar to disability in that way, is that we live based off of the healthcare system, and all of humanity lives based off of how we've built up everything with regards to a current stable climate. And everything can be impacted when the climate changes. Food production, natural disasters impact public health, and eventually when sea level rises at the coast, people will start migrating. So everything becomes in flux. And when we work together, we have to work together as a world on mitigation and adaptation. So first of all, a couple of words here. Mitigation is cutting down emissions so that climate change doesn't happen as quickly. Adaptation means building up seawalls in Miami or reinforcing California's water infrastructure because of drought. It means preparing for it. Unfortunately, not enough is being done. Number one, some groups are denying that climate change exists and then fighting to do any mitigation. And on the other hand, this is actually something I'm seeing in Paris, is that a lot of people are focusing on mitigation and cutting emissions, but very few people are saying this is coming down the pipeline and we need to start getting ready for it. So that's one thing I like to focus on. Not enough is being done. Well, climate change is real, first of all, fighting those deniers, and here's how it works. Okay, so a lot of people have heard about the greenhouse effect, and I say that the Earth is a greenhouse. The way that this works is that the sun is what keeps the Earth warm. It's what gives heat radiation over to us. Some of that solar radiation comes in and is absorbed by the Earth's surface, most of it is, or the atmosphere. Some of it kind of bounces back into space, but the stuff that stays on the Earth's surface and in the atmosphere just spins around in there, keeps the Earth warm, and the reason for that is that there are these little particles called greenhouse gases, and the greenhouse gases, they vibrate when the sun's heat hits them, and then they just keep the atmosphere warm. And every now and then some of the warmth radiates back into space, but that's pretty much the basics of it. Okay, so back to the basics. Number one is that there are many greenhouse gases. Carbon dioxide, CO2 is the main one. There's also other ones such as methane, and that's actually a lot more potent than carbon dioxide, but it's lower concentrations in the atmosphere. Burning fossil fuels releases carbon dioxide. Deforestation releases carbon dioxide because the plants decompose, or if there's a forest fire, they go up, their burning goes up into the atmosphere, and there's less plants to absorb CO2, so that puts out more greenhouse gases. The atmospheric greenhouse gases have increased since the beginning of the Industrial Revolution. In 1870, they were 280 parts per million, so that's 0.028%. And in 2015, it was over 400 parts per million, and it's climbing. So since 1870, temperature has increased about 1 degree centigrade, and doesn't seem like a lot, but it has huge impacts. And more emissions and what we call feedback loops will raise greenhouse gases and temperatures even more. So feedback loops, for example, is if it's drier because of climate change, then there will be more forest fires, which will release more carbon dioxide, and then they'll just keep on going. And here's a couple of images, a couple of graphs. Number one is the CO2 concentration that just keeps going up and up and up. On the top left, it was under 320 parts per million in 1960, which is when we started having really accurate measurements. And then on the bottom right, the temperature, global temperature, which also just keeps going up and up and up and up. So here's the deal with climate change. Is I was just showing how the Earth gets warmer. Well, what happens is you have various impacts there. You have direct impacts, which is stronger and more frequent storms, so the atmosphere can hold more it can hold more water when it's warmer, so you get stronger and more frequent storms. You have expanding drought and forest fires. We've already seen that a lot in California. Sea level rise and ocean acidification, so all the ice is melting and raising the seas, and actually warmer water expands. More intense heat waves. Seen a lot more heat waves going on in the US lately, and general weather pattern changes. And the thing about that last one is that we've built our societies and kind of planted our crops based off of the existing weather patterns where we live, and they're changing a little bit. So it's not necessarily that it's bad that it is some different weather pattern in itself. It's that it's changed from what we are used to. So indirect impacts are infrastructure damage. If you have sea level rise, then it can get into, say, the New York subways, food insecurity because of those crop issues I was talking about, and drought, poor health and mortality connected to all of these things, economic disruptions, which will be a long-term issue, environmental and ecosystem instability, so actually you can get a kind of rapid collapse of ecosystems, which has, again, ripple effects, and then widespread migration, climate refugees. And this last one, so let's say that there's a lot of flooding in some low-lying area, and then everybody has to move because their land is underwater. That could be number one. Number two, there could be an extreme storm, and then they have to move away and then come back and then they're not able to come back home. There's a lot of things there, and actually I'll talk about that a little bit later on in the presentation. All right, so climate change and disability. So as I said, climate change will have many impacts, and each of these impacts will hit people with disabilities in unique ways relative to the able-bodied population, and those things will require focused preparation. And by the way, we're going to need just preparation in general, but the way that it hits people with disabilities will be a huge one. So number one, you've got storms. There's Hurricane Katrina. Drought, that's a very sad farmer. Heat waves, that's a photoshopped picture. And sea level rise, this is a model of San Francisco with, I think, 25 feet of sea level rise, which isn't totally out of the realm of possibility, granted a century or two out, but there's AT&T Park, the Giants baseball stadium, just flooded. So we'll see what happens with that. Okay, number one, there's going to be a greater prevalence of disability. So climate change will contribute to what they call disability adjusted life years, which is DALYs. And that's saying reduced quality of life times amount of time that, or quality of health, I guess, times the amount of time that somebody has that reduced quality of health or disability in general, severity of disability. So that's the existing focus of major climate reports, is saying how much will climate change contribute to disability. They don't say how it will impact people that already have disabilities. They say how will it contribute to DALYs. So it'll have a lot of causes: storm-related injuries, malnutrition, invasive diseases. We'll have more malaria coming in and around, and then climate-related conflict and war refugees. They're saying that Syria is having a drought, and that caused the conflict. So, and the last thing is that climate change will also disproportionately harm people with disabilities, but few are addressing it. So check this out. Okay, in addition to contributing to more disability, climate change has direct impacts on people with disabilities. Now here's the thing, is climate change isn't climate change in itself, it is a bunch of different effects, as I talked about earlier. So to see how it hits people with disabilities, you have to see, you have to break it down for each of these impacts. So let's look. These are some examples. Storms and extreme weather. All of a sudden, there are inaccessible shelters and evacuation methods. Somebody might not have transportation to evacuate where they live. There's fragile support systems. So if the medical industry shuts down because all of a sudden there's extreme weather, that can leave some people in a precarious position. If their caregivers or personal attendants leave early and leave them behind, then they won't have assistance either to keep their head or keep their head above water. Well, if there's flooding, then that's literal. Or to evacuate also. And then in recovery, there are financial and logistical considerations. For example, the need for specialized medical equipment that costs more money. They also might have fewer resources to start out with, and then a harder time recovering. Heat waves, people with disabilities have an increased chance for heat exhaustion and heat stroke. I myself have a spinal cord injury where I can't sweat to cool myself down. That's a huge impact right there. Reduced access to air conditioning because of poverty and substandard housing can leave people with disabilities in really reduced health because of that. Invasive diseases, which I mentioned earlier that there might be pests that come in and bring in invasive diseases, and there's a greater vulnerability because of fragile health, exacerbated by socioeconomic conditions. So anything that would hit somebody able-bodied in general, even outside of the greater health vulnerabilities for people with disabilities, they might have fewer resources to be able to adapt. Now, here's one more scary thing, is that all of these different factors that I mentioned earlier that will cause various disruptions, there's going to be migration because of that. I'd say it's scary but real up at the top of the slide here. Now, first of all, climate migrants are people that are forced to relocate due to climate-related factors. And there's a few different types right here. For example, if there is a storm, people have to evacuate and they can't move back. Those are migrants. If their homes become unlivable, say they live in Miami, and then the city floods and simply becomes uninhabitable and they have to move away. Those are migrants. There's a whole other category, which are people that have to leave because of major economic disruptions or sometimes war that is influenced by climate change. The Syrian civil war started partially due to a 10-year drought. So you could say that the refugees from the Syrian civil war are kind of climate migrants, or at least partial climate migrants. And they're saying, various experts are saying that there will be 200 million to up to 1 billion climate migrants by 2050. So this is a huge, huge number. And for people with disabilities, relocation is especially difficult. Number one, they have to find accessible housing. Number two, they have to reestablish or maintain support networks while they move from one place to another. Number three, they might not be able or have difficulty attaining social services and other benefits. If they move somewhere and the social services are overwhelmed, or for example, might have a lengthy application process, that can put them in a tenuous situation. And just doing an audio description of a picture right here, there's a polar bear leaning against somebody in a polar bear outfit and has a cardboard sign that says "Home melted, looking for any work to help feed my family." So a little bit tongue-in-cheek, but kind of sadly real at the same time. There are two things we can do in response to climate change. So first of all, there's mitigation, which is cutting emissions to slow warming. Many of you have probably heard about this. Everybody's saying cut emissions to keep us below 2 degrees centigrade, which is a major number that a lot of folks are talking about. So then there's adaptation, which is saying that climate change will happen to some extent, and we need to prepare for the coming changes. And that's the truth. Climate change will happen to some extent, and adaptation is absolutely necessary. And here's the thing. Adaptation takes time. So we really need to start now. And actually on the bottom left-hand side, there are all of these kind of different predictions for temperature change. If we really cut emissions, climate change is still going to be here, warming is still going to be here, and if we continue on the current trajectory or have intense feedback loops, then it's looking pretty scary. And on the bottom right hand here, I have a bunch of activists holding hands that say stop global warming in the center, and I just have to put a big sad face over the top of that because that's unrealistic, and climate activists need to realize that. So now we know that adaptation is necessary. What do we do for disability-specific adaptation as climate change projects? So Number one is we need to break things down into individual climate impacts and then address those one by one. For storms and extreme weather events and heat waves, we need solid disaster relief and recovery, which is called DRR. Number one, accessible storm shelters, cooling shelters, and reliable transit to and from those. Number two, recovery support and accessibility in public rebuilding. In Hurricane Katrina, for example, a lot of the public rebuilding that they had wasn't supportive of low-income residents or people with disabilities. So when we do rebuild, that needs to be a priority. So number two, addressing food insecurity and economic issues. So there are going to be economic disruptions. There's going to be food insecurity. So this is a motivation to increase the economic stability for people with disabilities in the first place. So reinforcing benefits programs and healthcare as there is economic disruptions, increasing employment and financial stability through those processes. In long-term migration and relocation, this is something that I'm working on more in depth right now, is when people move, sufficient accessible housing and accessible infrastructure when they move there so that they can live and move around. Strengthening local support systems such as independent living systems, independent living sisters, sorry, yes. So independent living centers, and these independent living centers support people with disabilities through independent living and keeping their heads above water. Number three, create flexible and resilient benefits. So when somebody moves from one place to another place, they need to be able to transfer their Medicaid and their SSI over there smoothly. And finally, personal education resources and support while people are going through each of these, because some stuff happens at the government and policy level and a lot happens at the individual level in terms of preparation and effective implementation of their own safety. So obviously this needs to be addressed. And how do we do it? Well, first of all, there are disability rights movements and there are climate activism movements, and we need to combine those and we need to create alliances. We also need to get things rolling on the policy front and on the move. So what do we do with that? Here are some of the concrete actions we can take. So number one, first and foremost, is that people with disabilities and disability organizations and agencies should be involved in all adaptation planning. This is tricky because preparation happens through a lot of entities at multiple levels, and there are recommendations, voluntary actions, and mandatory rules that come along with this. But the disability movement needs to absolutely commit to being a part of as many pieces in the adaptation planning puzzle as possible. The needs of people with disabilities should be addressed in all climate change preparation, and it should be made clear to people that aren't just those with disabilities that this needs to be a consideration everywhere. Then adaptation should be coordinated with other policy efforts, such as flexible and dynamic benefits. You know, when we're talking about baseline disaster relief and recovery, that's already there and people are working on this. We can use climate change as a motivation to do these things more in depth, to get more focus on them, to get more focus and attention on the needs of people with disabilities in existing movements and preparation. And finally, people with disabilities must be aware of this, must continually educate both their peers with disabilities and policymakers, and advocate continually. Movements keep on going and change happens through advocacy and through constant advocacy, and we can go on that road. Now, a couple more final things is we need to get involved now. Number one, climate change prep is already happening. You can see that nationwide and worldwide. Number two is getting disability into initial plans is much better than trying after they are finished. It's easier to coordinate and weave things in rather than try to modify plans once they are already made to incorporate the needs of people with disabilities, which is why advocates must start now and keep fighting through the process. And down at the bottom here, I've got two ovals, which is ongoing climate change planning and disability-related preparation, and they are combining to say synergy. Now, how can you help? Well, think about your interests, your expertise, your organization, your connections, and your capacity for change. Basically, your ability as an advocate to do what you want to do, and then learn more, go read up on these issues, educate others, bring them into the movement, strategize with them, team up with as many teams as possible and as many organizations as possible. Start on that advocacy, and then keep on fighting. It's easy in any advocacy efforts to kind of feel discouraged, but you just gotta keep fighting through it, and you can make some positive change. So thank you for watching. My name is Alex. I'm part of the New Earth Disability Project, which is under the World Institute on Disability, and here is the website, wid.org/NED, and my email address is alex@wid.org. So thank you, and keep fighting.